Good afternoon, everybody. This is Dr. John Callahan. I'm the chiropractor here in York, Nebraska. We have a clinic called Callahan Chiropractic. Um, we also have a functional fitness gym and massage therapy. We're an affiliate of 8 Weeks to Wellness, which is a wellness based move well, eat well, think well um, type of a program. And we'll be talking a little bit more about that later on. But I just wanted to welcome you to Know Your Five to Stay Alive. And tonight we're going to be talking about some measurable things that we can do to ensure that our body's physiology is going in the right direction. A lot of times, just in today's world, we often go by how we feel day to day. And how we feel, no matter what shape we're actually in, is going to vary. Some days we feel good, some days not so good. All of that is pretty normal. What concerns me as a doctor is we see a lot of people that their physiology is trending in the wrong direction. And so, what I'd like to do tonight is have a little bit of a discussion about that and just see where that leads. Hopefully, we'll be able to spur some questions. I'm real hopeful that you can learn some things. I know in studying for giving this talk, I learned things as well. There's a lot of things I was familiar with, but it never hurts to go over things again. So I hope you enjoyed the talk, and I'll do my best to explain things in a clear manner. I would invite you on our Facebook page, when you're watching this recording, if questions do come up, please feel free to comment below the video, and we will get back to you and try to answer the questions that you have in a timely manner. So I would just invite you to do that. So I'm going to make an attempt to share our screen here. And now I'm real little in the corner. We'll be going back and forth from time to time. But as you can see, it gives an overview on the first page here of the 5 to stay alive. And we'll be talking about each one individually as time goes on. So let's get started. So one thing that I think is important to talk about is when you decide on a doctor, what type of things do you look for? And so in my mind, this is the kind of doc that I would hope that I would like to go to. Someone that bases their recommendations are based on risk assessment and also physiological biomarkers and preventative. So what I see a lot of is people, we tend to be reactive instead of proactive. In other words, we wait till we have a particular condition or symptom and it finally gets bad enough that we go see our doc. So we don't want to promote the model of treatment of disease only. We want to actually get the body to actually function better and improve physiology, and that's what we'll be talking about this afternoon. There's other factors, genetic, physiologic, environmental factors. So in other words, it's not just a one size fits all type of recommendation. It's actually based on your individual situation. And most important, in my opinion, we want to empower you as a patient to do the things that we ask you to do so that you'll get the results. One thing I've seen is sometimes people have come and gone through 8 Weeks to Wellness and they do everything we ask them to do and they get really pretty good results and sometimes outstanding results. And then there's some that come in and they kind of think, in a sense, well, it's really up to the doctor and the staff to do it for me. And there's one thing I'll tell you is if that's what happens, I promise you will not get the results that you want, and you won't get the results that I want you to get. You got to participate. If we give you homework, we want you to do your homework. We want to hold you accountable so that you can make the changes that you need to form healthy habits. And we'll be talking about that. So those are the 4 things. Let's see here. There we go. So our little quote, the darkest place in hell are reserved for those who maintain neutrality in times of moral crisis. And certainly that can be applied in a lot of different ways. But in terms of health, we definitely do have a health crisis, and it goes far beyond the COVID and the coronavirus. There's so many people in our country, in the United States, that suffer from chronic degenerative disease, and all they're getting basically is medications and surgeries, and they're really not getting a lot of instruction on how to change their lifestyle in order to help themselves improve and improve their physiology. And the next quote here is from a colleague of mine, Dr. Dane Donahue, is one of the co-founders of 8 Weeks to Wellness. And what he says all the time is you can't medicate your way out of a problem you behave your way into. And that's so, so true. Now, this is a quote from Dr. John Kelly, who is the president of the American College of Lifestyle Medicine. And what he said, I'll just read it to you. Symptomatically treating disease without assessing the patient's lifestyle or offering guidance on how to change is irresponsible and bordering on neglect. So this isn't Dr. John Callahan saying it. This is a medical doctor whose job it is to affect people's lifestyles. And I feel exactly the same way. So that's why when people come in, we try to address their lifestyle. We try to address, what's gone on in their past, what's contributed to the fact that now they're in this particular situation they happen to be in and have these symptoms and problems. And then we try to go from there and make recommendations based on what's going on, what we think we can do to help persons' physiology so that they'll feel better, not only feel better, but they'll actually become healthier if they put it into practice. So you'll notice on our next page here, this is a list of risk factors that lead to health problems and ultimately death. And as you can see, when you start with dietary risks, tobacco smoking, blood pressure, high BMI, physical inactivity, high fasting plasma glucose, meaning high blood glucose, total cholesterol, when you get down to ambient particulate pollution, so those are the top 5 or 6 that I've just read off to you, and they're the most prevalent risk factors that there are in this whole chart here. And these are all, every last one, down to the particulate matter pollution, they are all addressable through 8 Weeks to Wellness. So there is a thing such as chronological age, which, I happen to be 63, so that's my chronological age. But there's also something called biological age. And what that is if you look at the person's physiology and you do measurements of that and compare it statistically to other people in your age category, where do you land? They did a study, which this slide talks about. It was called the Dunedin study, and it was a wide-ranging study. But one of the things they looked at was they started with around 1,000 people, from what I understand, and they started tracking them. And what this chart basically says is they started when these individuals were all age 26, and then after 6 years, they rechecked the same biomarkers that they checked when they were 26, and again did the same ones at age 38. And the purpose of it was to see people's physiology and to see where it landed in terms of age group. So in other words, and you all, I'm sure if you really think about it, have seen this. There are people that are, say, for example, 38 years old that, they function like a 25 or 28-year-old, and 38-year-olds that function like a 50-year-old. They're the same chronological age, but biologically, they're very different. And so that's what we're talking about. So they did some of the tests that we're talking about tonight were in the study, but it's an interesting thing to just see along that chart there how they all landed. I mean, the majority of them were in close to their chronological age, but there was some that were extremely older biologically, and there were some that were extremely younger that were biologically younger. And as you can see on the bottom there, those that were biologically older had decreased physical strength, decreased cognitive function, decreased balance and motor skills, and decreased arterial diameter in the retina. So what that means is they were beginning to suffer from atherosclerosis or plaquing of those small arteries. So again, something to look at. And again, just going back to what we've been talking about, successfully treating any one disease is certainly not going to solve the problem of multiple morbidity and aging. So, another slide from the Mayo Clinic, the top 10 reasons people go to the doctor. I know it's an old slide, but certainly if you look at that and look at it as a big picture, these are all chronic degenerative problems, just every one of them. It's not, there's no acute infectious disease, there's no COVID-19, there's no malaria, there isn't even the flu, as you might say upper respiratory, but most of these are all chronic degenerative situations. So these are the top 10 reasons that people go see their doc. So there was another study, it was called the EPIC study, and you can see what it stood for. It was done in Europe, Cancer and Nutrition. What they found was there are 4 simple behaviors that improve people's health outcomes. Don't smoke. Well, pretty obvious, right? 3.5 hours of exercise a week. So that means you go for basically for a half-hour walk every day. If your BMI is under 30, and body mass index, I think most people are familiar with, but it has to do with the percentage of muscle versus percentage of fat. And then eating a healthy diet. Now, they considered a healthy diet. I would consider it fairly healthy. There are healthier diets out there, but basically they ate fruits, vegetables, beans, whole grains, nuts, seeds, limited amounts of meat, and moderate alcohol intake. And that's a 2009 study. So basically, let's see, had good outcomes. It prevented 93% of diabetes, prevented 81% of heart attacks, 50% of strokes, and 36% of all cancers were prevented. And the average person that did these 4 simple behaviors lived an additional 14 years. Here's another study that was done. It was in looks like the United Kingdom and printed in the British Medical Journal in 2014. An increase in skirt size was the single most predictive measure of breast cancer risk. When women went up a single skirt size over a 10-year span between their mid-20s and mid-60s, they were shown to have 33% greater risk of developing breast cancer after menopause. And if you went up 2 skirt sizes during that same period, there was a 77% increase. So again, it has to do with waist circumference, which is something that we measure in 8 Weeks to Wellness. So I'm going to take a quick drink. And so this is something called Pearson's Law. When performance is measured, performance improves. When performance is measured and reported back, the rate of improvement accelerates dramatically. So what this is referring to is oftentimes when people decide they want to change their health, they're really motivated, they're excited, they're ready to go. And that's all great. The problem is if you don't have a coach, if you don't have anybody holding you accountable, the chances of you, and if you don't measure things in the beginning other than your weight, for example, it really decreases your chances of being successful. If you measure physiological biomarkers to start with, and you have a coach, someone to kind of help guide you through it, and then you have that accountability piece, which is even more important, meaning you've got someone who's going to say, hey, have you done X? Did you do this homework that we asked you to do? And, you know, we can't force people to do anything, but by the same token, if that's not there, if you do it yourself, there's an old saying, if you could do it yourself, you would have done it already. And I think in many cases that's true. I know I'm one that I I have a coach that looks over me and my health, and I think it's very valuable. So that's Pearson's law. So biomarkers, 5 biomarkers, 5 to keep you alive. So first thing, anterior head syndrome. Let's talk about that. So what's interesting, you can kind of see the guy on the left here. I'll move my little cursor around. Hopefully you all can see that. But say a person's head, average weighs 10 to 15 pounds. So if you have anterior head syndrome, you can kind of see your head leans forward over your shoulders, and then there's an even more extreme example over here. So why is that significant? Well, you'll see a progression picture here that really illustrates the importance of it. But what's significant right now, if a person has anterior head posture, is for every inch that your head is forward, and when we measure it, if you have 1 inch forward head posture, that adds an extra 10 pounds to your head in effect. I often explain it to patients to say, if you carry a bag of groceries, you carry it close to your body. If you had to hold the bag of groceries out in front of you, it's going to feel like it weighs a lot more, and your arms are going to get tired a lot quicker because you're putting a lot more stress on those muscles. But if you keep it in close, and it's the same way with your head, if your head's over your shoulders, there's no stress involved. But if it starts to slump forward and further forward, it in effect adds 10 pounds for every inch that your head is forward. So it is a significant issue. It basically, as you can kind of see the guy on the right here, it kind of collapses your spine on your heart and lungs, compresses that area. It stretches. You'll see something here called upper and lower cross syndrome that we'll show you in a moment. And posture follows movement like a shadow. If you have good posture, you're going to be able to move better. You're going to be able to do things more safely. You'll actually be able to become stronger without risk of injury or lessened greatly. So this is the lower cross and upper cross syndrome, and I'll go back there. I'm sorry. So lower cross and upper cross are interesting because it has to do with poor posture. So what happens is there's a certain set of muscles in the upper part of your body and the lower part of your body that are super, super tight. So as you can see over here on the left, you have tight upper traps and levator, and you have inhibited rhomboids, which is in the mid-back, and serratus anterior along the sides there. And then over here, you have inhibited or weak neck flexors and then really tight pec muscles. So that's called upper cross, and that's how the body develops that poor posture. So that's one of the jobs that we have to do when we improve posture, is to stretch those tight muscles out and strengthen the weak muscles so they can become back in balance. And then lower cross syndrome is the same principle. You have tight erector spinae along the spine. You have tight iliopsoas in the front of the leg and hip, and you have weak abdominals and weak gluteal or buttock muscles. So that's lower and upper cross syndrome, and that's something again you address when you improve posture. Begin to improve posture in 8 weeks to wellness. So here's an example of someone who went through 8 weeks to wellness. And if you take a look at the guy on the left versus the guy on the right, which one looks younger? To me, as I look at that, the guy on the left looks older. And I mean, obviously, this guy is 2 months chronologically older on the right, but he looks a lot younger because he's starting to make the changes necessary to have a healthier life, to have a hopefully a longer, more productive life if he sustains that. Again, if you look at the every inch equals an extra 10 pounds of force, you can kind of see where the line is, and then the line on the right, it goes right from the hips all the way up to the ear, and on the left, it's gone forward. So Forward head posture is improvable in 8 weeks to wellness with postural improvement and specific exercises that will stretch out tight muscles and strengthen weak muscles. So here's the illustration to show you why it's significant if you have forward head posture. You start out with the guy on the left here, nice straight posture. You can kind of see forward head posture developing. And then pretty soon, over time, you start using a cane, which uses a walker, and eventually you're in the wheelchair. And we've all seen, I mean, as you look at this picture, and I too, I can think of, certain people I know or relatives I know in every walk here. And so if a person has forward head posture, even if you're at the second stage, now's the time to improve it, or even the third stage sometimes. But it gets really difficult when you reach the point where you're so rigid and the bones are so cemented in and the muscles are like rocks that there's a point of no return. But the point is, let's do something before it gets to that point. So it's a pretty powerful illustration of how significant forward head posture is. And of course, the ultimate rigidity and tightness is rigor mortis. And you can see this gentleman here on the left is in what I would call pretty close to the end stage of forward head posture. It's just really a difficult thing to reverse at that point. Okay, so next slide is just talking about the nervous system and how the spine protects the nervous system. And at the very top of the picture would be representative of the cervical area, or meaning the neck. And then the mid back is called the thoracic, and the low back is called the lumbar. And there's a set of nerves out of each level. And as you can see, the nerve supply in the upper neck, it has to do innervation of the immune system, the head, face, upper neck, ears, sinuses, eyes, auditory nerves, the mid neck, neck and shoulders, the thyroid, tonsils, teeth, ear, and nose, the thoracic spine, arms, hands, heart, coronary arteries, lungs, gallbladder, liver, a lot of internal organs. Basically, with the low back, it's the alignment of the hips, intestines. You get the idea. So every nerve that comes out of the spine goes to a specific area. And in chiropractic, when we do the chiropractic adjustment, it relieves pressure off some of those nerves. If there's any abnormal stress on a nerve or pressure on the nerve, you want to alleviate that as best you can. If you're able to do that, what happens is you'll be able to get more of the messages. I read something years ago that said there's 3 million messages every second coming from the brain to all the different parts of the spine, through all the nerves to all the different organs of the body. And so it affects pretty much everything we do as human beings and every function. So when we adjust you, that's still the most important thing we do in our office. But as you find, if you don't address some of these other issues, then it has a limited ability as well. Here's just a brief word about x-rays. As you can see, there's reasons we take x-rays. Sometimes it's to eliminate, a major disease process. Mostly it's to see, like for example, you can see here in the middle top slide, this person has lost their normal neck curvature, their cervical curvature, and that's a significant issue. We also measure things in flexion and extension. We do motion studies, which measure how well the vertebrae are moving. If they're moving correctly, that's a good thing. If they're not moving correctly, it's a good thing to know. And again, we do before and after studies so that we can, make sure that we're getting those areas that are not moving to actually move again. So x-rays are a part of that. So let's see here. So let's go back. All right, so metabolic syndrome. So I'm going to talk about that for a while. So metabolic syndrome is the equivalent of saying you're almost a diabetic. It's pre-diabetes, more or less. And so in men, if you have a waist circumference that's over 40, in women over 35, if your triglyceride levels 150 or more. If HDL 40, women 50, your blood pressure is over 130 over 85, and if your resting blood glucose is 100 or more, any of those, 3 or more of those indicate you have metabolic syndrome. And I can't remember the percentage, but metabolic syndrome, if you have it, you're at a significant increased risk for developing diabetes, cardiovascular disease, and all-cause mortality, according to the AMA Journal in 2002. I would say they'd still have that opinion today. So, the place that fat tends to accumulate in a lot of people that's really, really difficult is in the belly. That's called visceral fat, and that's an important thing to know if that's the case, because if you have, as it says at the slide, if you have a big belly, then you have some big problems. And what happens is you have higher stress, higher appetite, higher weight, and higher waist circumference or inches, increase in mortality, and you have a decrease in your amount of sleep, energy, focus, well-being, performance, and libido. So it's a significant issue with a lot of folks. So it's visceral fat. And the interesting thing about belly fat is it produces 17 hormones, and 15 of those 17 are inflammatory. So they contribute to the general toxicity in the body, and that causes, a lot of issues in the body, and can be, lead to all these diseases that we talked about here previously. So as you can see, there's all kinds of chemical terms on here, and a lot of them are, like I say, inflammatory. So we definitely, if we have belly fat, something we need to all work on. So a big Canadian study of over 50,000 people, mostly women over age 40. The researchers look at the BMI and at body fat percentages, and the major finding published in the Annals of Internal Medicine, people with the most body fat, more than 35% fat for men and 38 for women, were the most likely to die within a few years, regardless of what their actual weight or their BMI is. So you can kind of see the little picture here. Muscle takes up about a third the space of fat, and it still weighs. So muscle's a lot more dense, in other words, and so it just helps your body function a lot more efficiently. So the muscle mass versus fat ratio is something we definitely look at as one of the 5. So, and we don't use the InBody. Maybe we'll pick that up someday, but we use it's called RJL Systems Body Impedance Analysis Analyzer. And what that does is that breaks down the percentage of fat that we have in our body, the percentage of skeletal muscle. It calculates our BMI, does a couple other things as well, and it calculates some other things that we use when we have you come in. We start to compile the data that we need as a starting point, because we want to measure where we're at to begin with, so that we can measure it again down the road, so you can actually see the physiologic change for the better. So there is interesting things about cholesterol. Cholesterol is overblown, in my opinion, and it is a factor, but the things that we forget about cholesterol is if our liver doesn't have cholesterol, it's not going to function. And it's been made into such a bad guy, so to speak, that I think we kind of lose sight of that. So as you can see, the measures, the normal measures would be 200 or below for total cholesterol, but there's a quantity and quality issue. So a lot of people have heard of low density lipoprotein and high density lipoprotein, which the HDL is supposedly the good cholesterol and the LDL is supposedly the bad cholesterol. Well, I want to really go a step further than that. We want to make sure that our cholesterol is not small and dense. We want it to be big and fluffy. I guess the analogy that was used is you want it like a beach ball instead of a baseball. So if you have a nice, pretty window in the front of your house that you like to look out of, and I come over to your house and say, hey, I'm going to chuck one of two things at your window. One of them's a beach ball or a baseball, but you get to choose. Well, which one do you want me to throw? Well, of course you'd want me to throw the beach ball because that's just basically going to bounce off. If I throw a baseball, could do some serious damage. And these small, dense particles, it's easier for them to get into the arterial walls and create damage along the arteries, and then the plaquing and the atherosclerosis begins to build up. So it's really an issue of the quality of the cholesterol. Your triglycerides, you want to have them under 100, your HDL over 50 and over 60 for male and female. You want LDL under 100, and you want that ratio to be under 3. So ideally, your triglyceride to HDL ratio, we'll be talking about that too. You want it at 1 to 1, ideally. 2 to 1, it's okay, but not ideal. 3 to 1, you're kind of borderline, and you're really at a high risk if you get over 4 to 1. So your triglyceride to HDL ratio, there's a pretty direct correlation as far as increased mortality and development of cardiovascular disease and hardening of the arteries and so forth. And like say, you want these big fluffy particles of cholesterol, not the real dense small ones. So, and that's something we can measure in our lab work for 8 weeks to wellness. So I just talked a little bit about the LDL and the triglyceride to HDL. So I think we discussed that fairly well, but basically, if you have a ratio of over 4 to 1, I'll just kind of underscore right there, that's the most powerful independent predictor of coronary artery disease development. And that was a study done in 2008. So, okay. Here's the fourth one, it's hemoglobin A1C. So, hemoglobin A1C, hemoglobin is the iron portion of the blood, of course, and it is a measure of how much sugar has attached to the blood. So the HbA1c, if sugar attaches to blood, it does something called glycate it. And what glycation does to a blood cell, and then in effect the whole body, is it stiffens it, so it isn't as flexible or pliable or movable. As you can tell, we just said a little bit ago that rigor mortis was the ultimate rigidity. And so anything that causes the body, even a small part, to become stiffer is increasing our aging. And that's why it's so important to, watch what you eat, and so you don't have a lot of sugar running around in your body. And that's the more that gets in the blood, the worse you have it in terms of your blood sugar. So HbA1c, or I'll just call it A1C, you want to have it at 6.5 or less. It'd be great if it was under 6. A lot of people are walking around pre-diabetic. They're in the 6 to 7 range, and if you're, over 7, you're in the diabetic range. And, like I said, with diabetes, it does have a real significant increase in all the chronic degenerative diseases such as heart disease and all the other things that we talked about. But the predictive value of A1C for total mortality was stronger than just for cholesterol, BMI, or blood pressure, according to a study in 2001 published in the British Medical Journal. So the last one here that I have is blood pressure, and this is something that people are familiar with a lot, and resting heart rate. So basically, in the HARVEST study, 15% of hypertensive patients had a resting heart rate over 85 beats per minute, and approximately 27% had a heart rate over 80. So the higher the heart rate and the higher the blood pressure, they kind of go together. So there's 50 million Americans with hypertension and 1 billion worldwide. And of course, if you look, the cost for treating that is pretty high, 156 billion, and that was, almost 10 years ago. So sadly, we even find, because of poor diet, a lot of kids there's a 3% of children that have high blood pressure. You'd think you don't develop it till you get older. And there's 16% that have pre-hypertension. And so it's a significant issue. Um, so as you can see, um, here's a percentage of people aged over 20 years and over. 30% for women, 28% for men of all people, and you can see it's more of an issue in the black communities, and I'm sure there's reasons for that, and it's just not a good situation for anybody. So again, you want it to be around 120 over 80. If you're over that on the high scale, it's called prehypertension. Stage 1 is 140 to 160. Stage 2 is over 160. And if your top number is over 180, it's considered a health emergency, and the low number over 120 the same way. So you want to keep that diastolic pressure at 80 or lower if you possibly can. So those are the numbers. And again, global mortality risk, it talks about a number of different things. There's smoke from solid fuels, underweight, alcohol, unsafe sex, high cholesterol, overweight and obesity, inactivity, glucose, tobacco. Global mortality, that's the highest one, is raised blood pressure. It's the most common factor for people that have COVID. For people over 65 is high blood pressure, the most common comorbidity. One thing you can do to help yourself with, if you do have high blood pressure, once you have a plan to change your lifestyle to help alleviate that, is use magnesium. There is a product called Calm that we use sometimes, and we have some other magnesium supplements. But a study here says it does, if you take enough magnesium, I think it's 350 milligrams a day or 370, you will be able to drop your blood pressure 3 or 4 points on the top end and 2 to 3 on the low end. So that's a little bit of help already. Your resting heart rate. If you look at the chart there, you can kind of find your age group. So here's the women's chart. Down below is the men's chart. You pick your age and you can kind of see what shape you're in. So I'm in the 56 to 65 age range, and so ideally I want to be, in the 50 to 60 range, and so that's kind of my target, and you can find your own based on your age and gender. So this over here on this slide is called the wellness score, and I'm going to. This is a little bit of an older slide, but basically what it does, this one here, the wellness score, if you can see it at the bottom, this was done before 8 weeks to wellness, and this particular individual scored a 42. So the wellness score grades you like you're in school based on your gender and what the expected amounts are for the particular measure we're using. Then it assigns each one a grade, and then it combines it at the end. So this person got a 42, and then after 8 weeks to wellness, they went from a 42 to a 65. That's probably not what I would say is the typical result. I've seen that happen, but most people will come up at least 10 points if they do what we ask them to do. And if they really try hard, usually it's more than that. But it can affect, well, you can kind of see here, this person's A1C when we started was 6.2, and it went down to 5.5 just in 8 weeks. So it really improved a lot. You can see what it was graded, and so there's a lot of small improvements you can do just in 8 weeks. So if you look, you just start taking vitamin D. Look at that, get a 20 over here, and 8 weeks later, just in 8 weeks, you can kick that up really significantly just by that. And so their anterior head syndrome was almost 2 inches, and it went down to just below an inch. So So that's why we do these this wellness score. We do these physiological tests because they're all measurable, they're all objective, and they show that not only should you be feeling better or beginning to feel better after 8 weeks, it shows that your physiology actually improves, which means your body is trending more healthy. Here's a picture of an individual that started 8 weeks to wellness, and of course, you look on the right, well, they obviously didn't get there in 8 weeks, but over time, if they kept it up and took what they learned and applied it and really put it into practice, you can see what's possible. But you have to do the work, and that's the tough part, and that's why it's a lot better. People, think they have problem with motivation and willpower, and when all it is, you just have to get to a point where you're willing to develop a habit. And I read to develop a habit on average takes 66 days, and how they average that out I don't know, but it makes sense because when you have a habit ingrained into what you do, it's a habit. It's not something you have to think about. You don't have to summon up your motivation or willpower. It's just what you do, and that's a far cry from having to summon, because willpower only can get you so far. But if you can develop a habit, then it makes a huge difference. I'm going to quickly just get off the screen here, and just show you. This is more what we use for a wellness score, just to see what it looks like. And this was one of the ones I've done here a while back, so I'm not giving anybody's confidential personal information out. But so yeah, I'll go back and just wanted to show you what it looks like more in real terms now. So yeah, another before and after person, as they significantly changed their body shape, they changed their forward head posture, did a lot of positive things, and sustained that. That's the important thing. Is we can't fix everybody's problems in 8 weeks, but we can get you going in that direction. And if you take what you learned after 8 weeks and continue to practice and do that, and have a coach and have somebody that's going to hold you accountable, you can get fantastic results. But it just takes that bit. You have to commit to that. Otherwise, you just sort of drift off, and then pretty soon you find you're back, where you started, and that's always a discouraging thing. So, a little bit about 8 weeks to wellness. Let's see how I'm doing on time here. Okay, so when you go for 8 weeks to wellness, let's see. You get a bunch of stuff. That's the cover for the book. I think I'm going to go to the so you can kind of see. So I've got a copy of the 8 weeks to wellness book right here. Inside of it, it gives you an overview, basically, of what you're going to be doing. It has all kinds of information that you'll need for the 8 weeks. It spells out what you need to do in terms of time, and it gives you, food lists. It gives you tasks to do to prepare, and it gives you a whole bunch of recipes. Yeah, here it talks about guides to meat and fish, and so that's included. So you're not flying blind. Basically, you got some stuff to review, but that's one of the things you get. You also get this is a nutrition manual, nutritional guide, and this has some at-home exercise stuff. It has sections on how to go shopping. It also has a whole bunch of suggestions for food. Um, has some discussions on. Just a very informative, well written book. It was done by people that are a lot smarter than me. Put this together, and it's very attractive, and it's just a real. So you'll get a copy of that if you do 8 weeks to wellness as well. So you're not going to fly blind. So I just want to make sure I showed you guys that. Let's see. Well, Okay, so basically 8 weeks to wellness. You can see the different pieces: nutrition, meditation, massage, fitness, and chiropractic. So one of the questions we get asked, if I do 8 weeks to wellness, how much time do I need? How much time is it going to take me, hours and hours every day? Well, basically in a week you have 168 hours. If you sleep 8 hours a day, you have 112 waking hours each week. So the program on average should require you about 5 to 6 hours per week. Basically, that's about 5% of your waking time. So let's break it down. You need 3.5 hours per week in the office. You get one massage a week. It's usually a 60-minute massage in our office. You get 2 1-hour sessions with our trainer, personal trainer, Megan. Um, it's a planned progression of posture improvement, improving your mobility and flexibility, and a little bit of strength training. Now, I mean, it depends on the person. There's some people, let's be honest, they're not ready for strength training when they start. There's some people that are raring to go and they're going to go in full bore. So it depends on the person, but you'll be in with the trainer for about an hour. You get a chiropractic adjustment, which is important to help, if you're going to make changes, that stress, that extra stress on your body. I mean, it's going to be good stress, but it does stress your body. So it's important to get adjusted right along when you do 8 weeks to wellness. So there's 2 adjustments per week. You'll get one appointment as a nutritional consult. You either talk to one of our assistants, you might talk to me, you might talk to our trainer. All of us are trained in that type of thing, and we'll be able to help you kind of put that into practice and hold you accountable, because there are some foods you have to avoid at least for the 8 weeks, and once the 8 weeks is over, you can reintroduce some of those, and we teach you how to, instead of letting the food or the drink manage you, we want to manage it, because if it manages you, then again, pretty much, you're back to where you started. So you'll also have some online meditation resources that we give you to begin to meditate a little bit every day. There are 60 minutes suggested, 3 separate cardio sessions. So you'll be doing some homework, some exercise outside of the office, and the trainer would explain what would be expected for you to do. You need some time, obviously, to shop, plan, and cook your meals. There's 10 minutes a day with the meditation, which I mentioned earlier. And then there's 5 minutes a night to review and record and kind of log. We want you to log what you're doing and plan for the next day. So basically, it's 5 to 6 hours a week. And of course, once you learn it and becomes a habit, then that lessens the amount of time needed. And of course, you get through 8 weeks. A lot of the stuff changes as far as the adjustments and the nutrition consults. So you wouldn't be spending that indefinitely, the 5 to 6, but that is for the 8 weeks. That's a pretty accurate assessment. So that said, it's time to wake up. So, when we don't feel good, it's hard to think about other people because we don't feel good. So we're kind of selfish in that way, and it doesn't mean that you're a bad person, but when you don't feel good, it's hard to care for others and do for others. You can still do it, but it's hard not to think of yourself when you're hurting. So, you always think of, well, when's the best time to make a change? And, we can always come up with reasons why it isn't going to work right now. But in my experience, there's always going to be that, well, I'll do it after I fill in the blank. Well, after that's done, well, then this other thing came up. So now I can't do it. And I mean, I know how that works. And so again, if you want to make a change, the best time to start is right now. And I think most people would agree with that if you're really thinking clearly. And so in my my mentor, Dr. Dane Donahue, says at some point you have to make a decision in life. Are you going to be a blessing, continue to be a blessing to your family and your friends, or are you going to become a burden? And that's a question I have to ask myself. And it's one reason why I try to practice what I preach the best I can. I don't always do it perfectly, but by the same token, um, it is a doable thing, and it is a serious question I think we want to ask ourselves. So that said, We do want to give you a special offer. If you've lasted through this whole presentation, I really congratulate you, and I appreciate the fact that you took the time to watch this. So what we want to do is if you're interested in exploring what 8 Weeks to Wellness might do for you, we're going to offer you a special deal. We have customized lab work that was done for 8 Weeks to Wellness. It's by Vibrant America Labs. They've got a special deal, and the whole deal with that and the wellness score is valued at $417.50. We are going to give you the price of $259. It's going to be good only through the end of the month. So you got a window of approximately 10 days. That's a great price. I want to just show you what the lab work would include. It will include vitamin D, include a lipid panel, your LDL direct and HDL direct, homocysteine, C-reactive protein, which is an inflammatory marker, your resting glucose, your resting insulin, resting insulin. People don't often get that one, and that's another really important one. You'll get your HbA1c. These three are liver tests. These two are kidney tests. You'll get a fatty acid panel comparing your omega-3 and omega-6. Omega-3 is anti-inflammatory. Omega-6s are inflammatory, so the idea is we want those to balance out. Most people have way too high omega-6 and not enough omega-3, so we want to do that. In addition, there's also two really neat genetic tests. The MTHFR is a genetic test that will tell us if you fall into a particular category. They're called APOE, and there are two, APOE3 and APOE4. If you land in the APOE4 category, statistically you have a 16-time better chance of developing Alzheimer's disease. And I don't know exactly why that is, but if you are one in that category, it doesn't mean that you will have Alzheimer's. It just means your risk factor is much, much higher. So that's a genetic factor that would be good to know if you're interested in that. And the other one is the APOE. I think that's what the other one is it's not listed. It is a test to show if your body breaks down homocysteine correctly. If it does not, homocysteine is another inflammatory marker with increased risk of heart disease. And some people don't break down folate correctly, which is a B vitamin. And if that's the case, then you may end up with higher homocysteine levels, and sometimes that's genetic. So that said, that's a very good value. You can't really beat it. We include with that and the wellness score, we're going to get all those 5 biomarkers we talked about, plus some other things. We plug that in, get your wellness score. Then we've got some things to start with. We've got some things. So if you wanna change, if you think it's time for a change and you're ready to do it, ready to find out, explore more, now's the time to do it. So remember, this is good through the end of the month. So in closing, again, I just want to thank you all for taking the time to listen to the talk. I hope the information has been valuable. It's been valuable to me, and I hope it is to some of you as well. So again, I appreciate you all, and thanks for listening, and we will talk to you again.